Okay, folks, let's talk about urinalysis interpretation. What exactly do your urinalysis results mean, and how can we find a patient's health conditions based on what is found in their urine? We'll go down the list of the things that you found in your urinalysis test, starting with color. We already know that color can be a very good indication on whether or not a patient is well hydrated or too hydrated or dehydrated. We can see that up here where the urine should be some kind of color. It shouldn't be completely clear and colorless. It should be more of a pale yellow, but definitely shouldn't dip into the dark yellow or amber color or even brownish color like the severe dehydrated sample down here. But there are other colors that can come up in your urine. For example, an orange color may show us extreme dehydration, or it could also show us liver problems, because when your liver has problems, you end up not getting rid of old blood cells, and that means that they get into your urine, and that could be bad. You could also have a pink or reddish color. Blood could be in your urine. Some foods cause your urine to be a little bit more red or pink. Some medications do this. Same with blue or green. Specifically, I know that green urine can be caused by a bunch of those multivitamins that have a lot of phyto. What's the word I'm looking for? Um, can't remember it. Anyways, if you take a multivitamin that has a lot of plant product in it, they might have a byproduct that is used for chlorophyll and stuff that ends up in your urine, making your pee very green. We could even have some instances of really dark brown or black from some foods, but more often than not, that's actually leading to chronic kidney failure because, of course, the large amounts of reddish blood getting into the urine causing it to darken and darken into the red maroon color. Your urine should also be on the clearer side, maybe slightly cloudy. In fact, this is an actual test that is done on urine samples in lab to see if you can read text through it. And if you cannot, that might indicate that something is wrong. Sometimes your urine is cloudy just because of the things you eat, but we definitely don't want it to be opaque or turbid, as they say clinically, because the more likely it is on this spectrum over here in the clarity, the more likely you're dehydrated. You might have a UTI, which is a urinary tract infection. You might have chronic kidney disease or even diabetes to the point where you're dumping a bunch of glucose into your urine, making it cloudy like this. So we definitely want our patients to have clear or even slightly cloudy, most of the time clear urine. pH is something that we measured in our urinalysis. It measures how acidic or basic the urine sample is. The lower the pH means that the lower or the more acidic the urine actually is, which means that more hydrogen ions are being excreted, which is fine because we're getting them out of their blood. So a normal pH of urine might be on the more acidic side. We know that water is typically 7 on the pH scale. So urine might be a little bit more acidic, but it might also range up to about an 8. More often than not, though, your urine is going to be close to water in this quality. 7 to 7.5 is an optimal range. I wouldn't say anything is wrong with 6.5 for a pH of urine. Especially because pH in urine is most dependent upon the patient's diet. More testing is needed to be done to make sure that this is actually what's causing problems in the patient. But a low urine pH might be the result of a high protein diet or diabetic ketoacidosis, where there's someone who is starving themselves to the point where they are burning ketones and or burning fats and having ketones as a waste product. We'll talk more about them in a little bit. And ketones happen to be a little bit acidic, so they're not supposed to be in your blood. So your urine has more acids because of it. Could also indicate chronic kidney disease or any other metabolic syndromes. And if you have a high pH, that means you have less acids in your blood and less acids in your urine. Sometimes that can indicate a UTI because bacteria like a nice basic environment that doesn't burn them alive, or even the risk of increased kidney stones because kidney stones are made of calcium phosphate, which tends to react with acids. So if you have a basic urine, then that means that your kidney stones are starting to thrive a little bit there, starting to build. The most interesting one, I think, is specific gravity. It is a mathematical ratio that compares the density of a sample to the density of water, meaning that the higher the specific gravity of a sample, the farther away from 1.0 more up to 1.03, that means that our sample is more dense and more concentrated. And we already know that a more dense and more concentrated sample would mean that that patient is likely dehydrated, like this sample over here. Whereas a lower specific gravity, one closer to 1.001, is going to be an excessive hydrated sample. The sample is almost entirely water because it has the same ratio of density to water. It could also indicate something called diabetes insipidus, not the diabetes that you're used to, but a different kind of diabetes, which is a deficiency of ADH. That's the hormone that tells you how much you have to pee and retains water inside your body. Well, if you're deficient in ADH, then that means you're peeing more out and therefore getting rid of more water. Um, Specific gravity closer to 1.035, like we said, could be a dehydration, could be some other kind of kidney disease, because that means that more and more stuff is inside uh, your sample. Now for the itty bitty things that may or may not be in your blood, or excuse me, in your urine, and probably shouldn't be in your urine, starting with proteins. Proteins are building blocks of all cells, and therefore they can be kind of recycled pretty well in the body, which means that if you do have an excess of protein in your blood and it gets into your urine sample, that is a problem. We want to keep as many of these proteins as possible. Often it makes your urine sample kind of foamy like that, but maybe your urine sample is sitting out a little bit and it doesn't have that foam on top. So no protein should be in urine. Anything above 0 is a positive test for proteinuria, as we call it. A high protein in urine could indicate potential kidney damage, especially chronic kidney disease. In fact, when we were looking at activity 413 for chronic kidney disease, you were looking at protein albumin, which is a protein that ends up in your urine as a byproduct of all the other stuff your blood does. And that albumin is a pretty clear indication as that number increases how much kidney disease you might have. It could also be due to temporary issues such as fever or extreme dehydration due to pushing yourself too hard at the gym and getting way too swole. Those proteins getting shed off your muscle cells as you try to build your muscles back up could lead to them getting into the urine. So, definitely two wide ranges of spectrum. Either you're dying with kidney disease or you're just a little dehydrated. Try to cool off on getting swole, bro. Glucose is freely filtered through the glomerulus, but almost all of it ends up back into the bloodstream, reabsorbed in the proximal convoluted tubule. Therefore, there should be no glucose in the urine. So, any detectable glucose indicates what we call glucosuremia or glucose in the urine. Uh, we equate that because there's too high of glucose in the urine, there must be too high of glucose in your blood. So we call that hyperglycemia, too much of glucose in the blood, aka high blood sugar. This is often the case in people suffering from diabetes. So anytime that we have a hyper or glucosuria sample, we test them for other problems related to uncontrolled diabetes. Ketones are the result of when we are burning fat instead of sugar. Sometimes when you're trying to lose weight, you get through your sugar reserves, and finally it's time to burn the fat inside of our adipose tissue. So when you're on a low carb diet or you're fasting or you have intense exercise or dehydration, you are burning fat instead, and ketones are a byproduct of that. However, your body will use those ketones to make more ATP later. So therefore, there should be no ketones in the blood whatsoever. So anytime we do have ketones in the urine, also known as ketonuria, it can indicate uncontrolled diabetes or prolonged fasting or starvation. This is a good example of when someone has something like anorexia and is going through diabetic ketoacidosis or just ketoacidosis in general. When they have that condition, they're burning through as much fat as possible, and the body can't keep up and use those fats to make more ATP, flushing them out into the urine as a waste product. Anytime we see any blood, specifically erythrocytes or leukocytes, that is a problem because blood should stay inside your body. It should not be seen as a waste product by your kidneys and put into the bloodstream. So, when we see red blood cells, aka erythrocytes in the urine, this is going to most commonly indicate some kind of kidney disease, the chronic kidney disease being an example. Very late stage chronic kidney disease will have the blood getting into the urine very easily. It could also be indicated from some conditions such as enlarged prostates in men from things like prostate cancer, or it could just be from excessive injury in your kidneys and strenuous exercise and certain medications. So more testing is definitely needed when you see red blood cells in your urine, but most often than not, it's a bad thing. White blood cells, on the other hand, leukocytes, we know are part of the immune system, which means when we see them in the urine, that means that there's an excess of those white blood cells in the excretory system. And that most often indicates a urinary tract infection, some infection that's inside your nephrons or your ureters or your bladder, or maybe even a kidney infection that's causing your entire kidney to get rid of these white blood cells as much as possible. In fact, you can see those white blood cells here in this picture. That is a basic overview of all the things that we can see wrong with patients based on their urine. You have to combine that with their symptoms and patient history to be able to understand exactly what's going on with those patients. A urine sample is not enough to indicate what is wrong with a patient, but it is a good, clear sign that something is wrong with a patient.